one. Welcome, everybody, and welcome to another episode of the I Can Do It podcast. I'm your host, April Burke, and today we have an excellent guest, Dr. Deborah Ishida. Hi.
Hello, April. How are you? Thank you for having me.
I'm good. How are you?
I'm fine. I'm very well.
Now, for people that don't know, you're a retired medical doctor. However, you are also a stand-up comedian who I absolutely just adore. I love your medical stories you tell, stories about your family and things like that. You can be dirty and you can be clean, but I think like me, I think you prefer to do the dirtier stuff, right?
I do. I think it's a little bit more interesting. Some of the clean stuff, I think, is like watching paint dry.
Yes.
Although, if you're very good at clean comedy, it's phenomenal. I've seen some YouTube videos of clean comics and I say, wow, I'm really amazed. But for me, I tend towards a little of the dirty stuff because that's my life experience. And so I got to be me. Everybody else is taken.
Yes, exactly. And that's, I mean, I can turn anything sexual, like even just watching like my son's show Mickey Mouse, like the one day they were like, let's go searching for the triangle bush. I'm like, they're totally talking about vagina.
Oh, right. Yeah.
But they're not. When did you become a medical doctor?
I graduated in 1969,
Woo!
way before many of you guys were born, in UCLA from UCLA Medical School.
Oh, okay. When did you move here from England? Is that the time you moved?
Okay, I'm giving away my age. Woo! Okay, I came here in 1962. I graduated young from Southampton University and came over because my sister had married a guy who had been in the camps, the concentration camps.
Oh, wow.
And then he eventually ended up coming to America, but came through England one time, saw her, they fell for each other, and he invited her to come to America and marry him.
Wow.
And she did. And she sent us a picture of herself sitting in a golden armchair. So I thought everything in America was gold. Turned out it was gold fabric, but little did we know. And we all came over after that, at that particular time.
Nice. Now you married Mr. Ishida, a Japanese man. How did you meet him?
Oh my God, he was phenomenal. We were both in medical school at UCLA. He was 1 year younger than me, or 2 years. I think I robbed the cradle. But anyway, we went to the International Student Center on Hillgard Avenue to, in quotes, get away from medical school. And we met at the door. And he asked me to dance. And I looked at this skinny, nerdy Japanese guy with a crappy haircut, plastic pocket protector, polyester clothes, big Adam's apple. And I said, shit. Dance with you? And then I thought, well, gee, it can't hurt me. And 4 months later, I married him.
Well, that is an amazing story. That is so cool. I like that. And you have a beautiful daughter. You have one child, or do you have more?
I have 2 children. I have a daughter that was born 12 months after we got married, and everybody was counting.
I'm sure.
And I had to point out to them that the gestation period for a human is 9 months. For a manatee, it's 12 months, but I'm not a manatee. And it was totally kosher. And then I got pregnant 3 months after I had her. So we had 2 children, 12 months and 2 weeks apart. My second child is a boy.
Oh, wow.
Yeah.
And your daughter does stand-up comedy too, I kind of saw on your Facebook?
She does. When she can fit it in, because she's a marriage family therapist, and she's got 2 teenage children and a screwed up ex. And so does everything. Well, I help out, but I'm just saying
Yeah.
Yeah.
I know how that is being a single mom. And yes, my parents help me out too a lot. Yeah, it's great to have that, definitely. Now, you've told some funny medical stories before on the show. What are some of the craziest memories you have of being a doctor?
There are so many, but one of them was really when I did a physical exam on this young guy when I was a brand new, like, graduated doctor, you know, Dr. Ishida. And when they used to call doctor, I'd look around to see who they were calling. And I realized it was me. And I saw this young guy for physical and went to examine him. And he had a gigantic erection. It almost hit me in the eyeball. And I couldn't check anything. And I ran out of the room to this other well-seasoned German doctor. And I said, Inga, I can't examine him. He had a gigantic erection. And she says, Deborah, these young men, they cannot control their erection. You must hit the penis with a pencil.
Oh,
And I did it. And I still have that pencil at home with a deep groove out of one end. And I call it my Debbie Downer. Had many, many, many experiences, both good, funny. I mean, I saved a lot of lives. I detected a lot of cancer. I diagnosed many serious illnesses. I was a very good, I think my forte was being a diagnostician.
yeah. Yeah, and I'm sure you had amazing bedside manner too, because I love you. I think you're great.
Yeah, nowadays, unfortunately, when people come in, you know, we have electronic health records.
Yeah.
And it's more important to dot the I and cross the T and turn your rear end to the patient. I couldn't stand that. I was a hands-on person, examined them, spoke to them, empathized, really, you know, cared for them. And nowadays, I think it's not as good. And also, coming from a British background, we didn't have so many things at our fingertips. So we didn't just say, oh, you've got a pain in your belly. Let's do an ultrasound, MRI, CAT scan. We would decide what to do rather than just throw everything at you. And
Right.
I think that made a big difference in the way I practice medicine.
Oh yeah, definitely. And yeah, when I go to the doctor now, they don't look at you. They barely look at you because they're too busy typing in the thing and the computer. And I know a lot of them have said that they missed the old way with the old records, and because it's become so impersonal with that kind of stuff.
Now,
And yeah.
if you put your hand on somebody, that could be considered like sexual harassment, you know.
Yeah.
Just so you have, I didn't like the way medicine was going, and that's what made me get out of. I mean, I did not go into become a computer whisperer. I went into medicine to take care of people, and when it became a lot of computer based, for me personally, not for everybody, but for me, it was not the way I wanted to practice medicine.
Yeah. What year did you retire?
I retired actually in 2002.
Okay.
My son had also become sick, and that was another reason for me to leave medicine.
Yeah. Is he okay?
Yeah, I don't talk about it much, not because I'm ashamed, but because, you know, he has bipolar disorder.
Okay.
And he had a very bad episode where he jumped off the Getty Center Drive and almost died. He was on life support. And that was really basically the impetus that I had to take care of him. He broke every bone in his body and bled to his lungs and bled in his abdomen. And we almost lost him.
Oh.
And I was a widow by then. My husband had died very early in 1995. He was 51. He had a non-Hodgkin's lymphoma, and he died after 18 months. So I was by myself, you know, at that time, and very difficult time to go through.
Yeah, that is difficult. They told me that I was bipolar too, bipolar 1 I was diagnosed with, and now they're looking back saying they think it's a drug-induced bipolar because I used to do cocaine and be up, and then I would do the painkillers and downers and then be super duper depressed. And I made 8 suicide attempts. I used to,
Oh my God, I'm so
yeah,
sorry.
I used to overdose on pills. I would just take 4 or 5 bottles of pills. And as you're like, right afterwards, you're like, oh shit, what did I do? And then it's like, oh shit, it's too late. I can't turn back.
Right.
I used to try to make myself like throw up and things like that. And yeah, so, and I know how that impacts the families as well as the individual. It's very tough.
Yeah, well, the thing is, he had also taken marijuana at one time. I don't know how many times, but one time, just before he got ill, he smoked very strong marijuana. He was in a tent somewhere with some relatives, young cousins, and he smoked. He said, Mom, as soon as I smoked it, I felt my brain shatter. And he never was the same again. Right now, he's okay. He's living with me, and he's an organic gardener, and he's doing tremendously well, thank God. But
Yes.
at that time, he became psychotic, and it was the marijuana. Now, many people can smoke marijuana from now till next Christmas. I had a boyfriend who would sit on the cut sofa and just smoke a bong 24/7 and just get the munchies.
Yeah.
And but my son, it affected him adversely. Yeah.
Yeah, that's what cocaine did to me. It definitely screwed something up in my brain. I would become psychotic as well. And I do take medical marijuana now for PTSD and stuff, which is okay. But I remember back in the day when I would smoke it, it would make me crazy, and it would make me like very depressed afterwards. It definitely had an effect on the brain. It does.
Well, what made you do drugs, and what made you continue when you had adverse effects?
I had symptoms of, I would get extreme, the energy, the mania, and I always had bad insomnia because I have PTSD. And so I would always try to take downers at night to try to get myself to sleep. And then sometimes that wouldn't work, and then I would be up all night. So then the next day I would do cocaine to keep me up. Like, I was treating my symptoms. It wasn't like,
yes, I understand.
Like, ooh, let's go get high. It was like, let's try to feel normal, that kind of thing.
Yeah, I've met a lot of people who do drugs to treat symptoms. Yeah.
Yeah, it's amazing. And you shouldn't lie to your doctor, because I lied to mine and didn't tell them what I was up to. And so they put me on every medication known, like any antipsychotics, like I've taken them all, antidepressants, I've been on them all, and I just maybe should have just been honest and told the truth in the first place, and I wouldn't have to suffer all these years. So that's a life lesson learned that I need to share to people. Like, be honest with your doctor. Definitely.
Right. That would help. I've had a lot of people not be honest with me, and I have had a lot of people that were honest with me that weren't honest with other people. And but yeah, it doesn't do any good to hide it, but there's a lot of stigma associated with mental illness. It's an illness like any other chronic illness, but it just happens to be an illness of the mind. If somebody has diabetes or high blood pressure or cancer, people may give them a casserole, or they may commiserate with them. When you have somebody with mental illness, you don't get too many casseroles, and you don't get too many people commiserating with you. You tend to sometimes be, oh, okay, well, nice to meet you, and walk off. It's kind of a hard thing.
It is. And I've had doctors tell me that my medical conditions, like I had appendicitis, they told me it was in my brain because I was bipolar. Like, no, it hurts. Like I know it wasn't my mental illness. So I did went and got a second opinion, thank God, because my appendix was rupturing. Like, I would have died if I listened to the doctor that I went to. And you do get that kind of stuff where it's like, oh, it's just your anxiety. Don't worry about it. When I started having chronic pancreatitis, that's what it was. It's your anxiety. You're just nauseous because your anxiety. No, I'm nauseous because my pancreas is failing. It's ridiculous, the kind of stigma you get, even with medical professionals.
Well, my son was in the hospital after his terrible accident, and he started to have severe abdominal pain, and they were writing down what we call I&O, in and out, what goes in and what comes out.
Yeah.
And they were writing down so much urine, and he had a bowel movement, blah, blah. And I said, has he had a bowel movement? Oh, yes, yes, yes. Well, it went on for days, and he told me he was not going to the bathroom. And I said, have you done a rectal exam on him? It's very simple. You stick your finger up the rectum and see if there's a lot of impact. Right. No, we did it when he came in. I said, but that was a while ago. They didn't listen to me. And they kept on saying, well, you know, he's got a mental condition. This is a psychological. And I said, this is not psychological. This is something's going on. Anyway, they waited until he had a complete bowel obstruction.
Oh.
And he had to have major clean. I mean, and I was so angry, but they even ignored me. And I was a doctor.
Jeez, that is something.
Yeah. Yeah.
Wow. Mm-hmm. That is something. Now, you and I, we met at Dat Fan shows, Dat Fan yes. and Friends.
Yes.
You're on tomorrow night. I'm on Saturday night.
Right.
By the time this airs, though, it'll be over, and we'll be on to new shows.
Right.
But how did you meet Dat Fan?
Actually, it was through Sally Mullins. I love Sally, and she was the MC, or will be, at Dee's Nuts, which I used to perform in at the famous Comedy Store on Sunset Boulevard. Nice. And I've performed many times in the Comedy Store. I met Sally and really liked her. So one time we were on another show together, and she said, you know, you might want to be on Dat Fan show. Why don't you text him? And that's how it happened. I text him, and the rest is history.
That's awesome. I actually interviewed Sally Mullins, I think it was last night or the night before. My days all get jumbled together. Yeah, she is great. She's one of the first people I met on there. She actually hung out after the first show I was on and talked to me. It was just me and her talking there in the room. Dad had left. I think he was doing something with Katie, and everybody else had left, and we just sat there and talked. She's so awesome. She's funny as hell, and she's so kind and friendly.
She is. She's very giving. When you want something, she doesn't, you know how some people, oh, I've got mine and I'm not sharing it with you because you may take it away from me. Yes. No, she's not like that at all. What do you need? How can I help you? I've always admired that about Sally. I really have admired that about her.
Yeah, definitely. Now, since you're a single lady, have you gone any dating websites or meeting anybody or doing anything?
No. I mean, after my husband died, I waited 1.5 years to date because I thought that I wanted to die myself, and I'd felt that if I had a cyanide capsule, I would have taken it. Yeah. It was like somebody had cut me in half and said, okay, you're now a half a person, but big deal, just carry on. And it was devastating because I was married for 27 years, and we really had a wonderful, wonderful marriage. But I did start dating after 1.5 years, and I met some real humdingers.
I'm sure.
I actually started to only date black guys after my husband died. I'm very attracted to black guys. My friend says, Deborah, you are addicted to black flash. Whatever she calls black fat flash, okay, I'll take it. I like black guys, so I've had a series of black guys. One was a 2-minute man because sex affected his spiritual steering wheel, and but taking my money didn't affect him at all. And he almost bankrupted me.
Oh, Jesus.
Another guy was wonderful, but he couldn't stop screwing. I mean, going to bed with him, you had to pre-order room service. Another one was, I am the stallion, you are the mare. I will lead, you will follow. In my own home, and I had to walk on eggshells. Abusive. Ooh, got rid of that. The last one I had was for 11 years. Long time. 25 years younger than me. But he started to have some difficulty in bed.
Oh, wow.
And he turned to me and he said, we need to do something different, Deborah. You need a boob job. And I turned to him and said, no, you need a fluffer.
Yeah. Yeah.
And right. So that kind of ended. Although he said he would still marry me without a prenup, or we could have an open relationship.
Oh,
And I told
no.
him I felt I would be fucked either way.
Yeah, you would be.
So that ended a year ago. I do miss that a relationship with a man, which is very different than a relationship with a friend or with a son or a daughter. I miss that intimacy.
Yeah.
But I don't know what's out there anymore.
I recently met somebody, and our first date lasted 7 days. I
Really?
talked to Sally about this the other night. Yeah, he is. We kind of Googled it, and we're kind of like what they call a twin flame. We have the same like background, the same traumas, the same kind of lives that we've lived. He's a single dad. I'm a single mom. Even his son was born on my birthday. Like, there's so many strange correlations, and I just feel like I've never felt like this with anybody ever before. So I'm loving it. He's actually.
Oh, well, April, I wish you the best. I mean, wow,
you.
that would be so fantastic if you found a partner that you were compatible with, that you could spend time with,
Yes.
maybe a lot of time with. I'm very happy about that. But my daughter has an ex who is deadbeat dad, never sends the kid even a smell of money. And she started dating, and she's had some humdingers, you know. And sometimes she says, Mom, I go on a date, either on, virtual date or, now in COVID, a separated date, but having a drink on a patio 6 feet apart.
Right.
And they say they like me, can't wait to see me again. Never hear from them again.
Huh. That is weird. Yeah, the dating pool is not that great. There's like too much chlorine in it or something. It's just.
Well, for me, I'm older. Like I say, I had a younger boyfriend. I like younger men. But the older guys, they want 30 and 40-year-old girls. So what's going to be left for me?
Yeah.
I don't want to be a nurse with a purse and push somebody in a wheelchair.
No. I
don't
blame you.
Yeah.
I don't blame you at all.
Yeah.
Yeah, and the online dating is just, it's horrible. My friend Cheryl, she goes on all these websites, and it's a lot of people scamming, asking her for her bank information, asking her to send cards.
Goodness.
Yeah, it's ridiculous. And I can't believe that women and men, they both fall for this, because I have a friend who also sent this girl $450 because she wanted to get a plane ticket to come visit him.
Yeah.
I told him, you should have got the ticket, not sent her money. And he's on disability. He's disabled. He has cerebral palsy. And she contacts him, well, not in a while, but she used to contact him at the first of the month when she knew he got his disability.
Oh.
Like what? These people are just disgusting. Like, I just don't understand it.
Well, don't forget, I remember seeing on some of those reality shows, these older women that think these young, it turned out to be black guys, but it could have been anybody, but they were guys from Africa. And these young guys were writing them, telling them they loved them. They saw pictures of, they were sending them thousands and thousands, actually depleting all their savings. And they would not believe it, even when they were told on the show, there is no such guy and he doesn't live there. They didn't believe it.
Wow. That's
so
great.
I guess people need love. I guess the truth of the matter is, we're social beings. Man is not meant to be a solo person.
Right.
And so we crave that connection. But sometimes we crave it so much, we do crazy stuff,
Yeah, that's true. I mean, I remember I was jumping from relationship to relationship because I didn't want to be alone. And
right.
that, and that's just not a good thing, because you overlook so many red flags for that. And then you find yourself in a shitty relationship, an abusive relationship like I did. And it's just not cool. Definitely not.
Yeah, have to be careful. So I don't know, I may be alone for the rest of my life, or maybe not. All of a sudden, somebody will fly in the window. Hopefully not a bird. I mean, a man, and that would be great. I'm up for it. I'm ready for a relationship. People say that as you get older, you're not interested in sex, and so that has never been the case for me. Never. I enjoy physical relationships. I enjoy the closeness. I enjoy the intimacy. So
yeah, I do too. I never got that either. Like I'm thinking my sex drive is gonna die. Like I don't see it happening. I have
no, so look
such
at me and be reassured. It's still going to continue.
awesome. I love it.
Yeah.
Where can we find you on social media for people to follow you?
Well, I'm on Facebook, Deborah Ishida, and I'm on Instagram, I guess, at Deborah Ishida.
Mm-hmm.
And those are the oh, and I also am on YouTube, Deborah Ishida, I guess.
Oh, I gotta look at that. I didn't know you were on
Yeah,
that.
and
That's
I've done
awesome.
a lot of Tim and Eric shows. A lot of people love Tim and Eric. I don't know if you know them, but they're really
I've
good.
heard
And
of
I did a
them.
whole series where I was their nurse. There was a series called Dr. Wareheim, and I was the nurse, and it was really hilarious.
That's cool.
Unscripted and improv. I mean, it was really interesting.
Oh, that's cool. Improv is a lot of fun. It is.
In one of the shows, I went on as a nurse, and there was a guy there, and I had to tell him that I was very sorry that we had lost, the doctor had lost his stool specimen. So I bring in a tray of jars with stool specimens, and I ask him if he could identify his. And he starts looking at it, and then he starts shaking the tray. I never knew this was going to happen. And the whole bloody thing fell on the floor, and it turned out it wasn't plastic. They were glass jars. And all this, it turned out it was brownies that looked like shit, but I didn't know. I mean, and it was all over the floor, and we had to stop filming because of all the glass. I hadn't known they were going to do it. I said, oh my God, what the fuck? You know? But it turned out to be a really good episode, you know.
That's awesome. Do you have any upcoming projects you're working on?
Not really sure. I mean, I'm doing the stand-up Zooms with Dat Fan. I'm doing them with Keith Graeber and Ed Rosgen are doing Locked in a Room. And then they're doing another thing is called a shit show, which is improv. Even going to do that tonight. And then they've got a roast. I'm going to be doing that. So I'm seemingly doing a lot of that.
That's awesome.
I also I got an audition yesterday from my agent to do a self-taping, and I really wasn't feeling 100%, but that wasn't all the problem. I loathe self-taping.
Yeah.
To me, I don't do it well. I'm technologically not savvy. I get nervous. I'm not sure about uploading it. And that's one of the things that's happened now that I do not like about acting is the self-taping. Other people are loving it, and I know I should learn it, but somehow it doesn't go in the noggin here.
Let me tell you, it can be a pain in the ass to like edit this podcast sometimes because I'm on like a really slow computer, and it takes like all morning and afternoon just to upload it, and then I got to edit it and stuff. But I'm getting really good at it, and I didn't think I would have a shot at it, but I'm getting really, really good at it. But sometimes you'll see in my videos stuff like me touching the camera, like like I try.
You're only human. You're not a robot.
Exactly. And in the
I don't know. How do you upload this kind of, you know, some things say too big. Even Facebook, if you put a video, or Instagram, if it's more than a minute or something. So 30 some minutes must be very difficult.
It is. I found a program I use with Microsoft, this HD movie maker, they call it. And well, my first episode I did on my phone with iMovies on the iPhone, and that was simple. That's where I did my trailer too. And yeah, you drag in the clips that you want to put in, and you can put like pictures in front or behind. Yeah, it's really interesting. It's pretty easy though once you get once you get a grasp on it.
Well, but you know, in medicine, there's this motto: see one, do one, teach one. But I'm not the kind of person that does well like watching a video on YouTube or something and then implementing it. I'm much better if somebody was with me, showed me. But now with COVID, that's not possible. So I'll have to wait a while. And my daughter, who knows everything, she's always on the phone. Every time I ask her, Mom, oh, Mom, this is so simple. Can't you do it? And then she kind of shows me, and it's like, oh, you know. And then I go, oh, fuck. You know, I mean, I'm like a deer in the headlights, and hello.
Yeah. I'm like that with my parents too. They were both computer programmers for like 30 something years, and they get their laptop, their first laptop, and they couldn't figure it out. I was like, what the hell?
Right.
Like, that's what they did for a living. Speaking of COVID, what are your thoughts? You want to tell people to wear a fucking mask or what?
This is a terrible illness, and we're not doing a very good job containing it. You know, in America, there's just, we have 4.25% of the world's population and 25% of the world's coronavirus cases. We have like 160 some thousand deaths, and they predict that by December, there'll be about 300,000 deaths. And of course, there was a second spike when everybody started, you know, to go to the beach without masks and go to bars. The bars are probably the worst things. Yes. Because close contact and droplets from talking and laughing and whatever. So if people would wear a mask, wash their hands, socially distance, I mean, come on, guys, it's not rocket science.
I know, it's not.
In America, we have this thing of freedom. Yes, America has been great to me, and I love the freedom in America. But when you talk about freedom in a stupid way, in that I refuse to wear a mask, you know, you can't make me, and they're mainly Trumpsters. Yes. You wonder, what is wrong with these people? If you don't, you know, you're going to pass it on to somebody, and people think, oh, it's only the old people, so if they die out, big deal, they're going to die anyway. Okay, you're disposable, which I don't like the thought of, but that's your thought. Now, this COVID is hitting younger people, the 18 to the 40-year-olds that were out there partying. So it is not a disease of old people. It's not a disease of old people.
No, definitely. And I had it back in March, and my health has not been the same since. I first started getting sick in February when I started my son in a Head Start program, and I had like 5 different viruses. He only went there for 4 days, and it was scattered throughout weeks, and I was just sick every week. And then I went to New York City the weekend of March 6th through the 8th, and I did a show there, and about 7 days later, the symptoms started. I was like, that's where and my mom even told me, like, are you sure you want to go? And I'm like, I'll be all right, because it was in the beginning, and I was like, it'll be all right. I can beat it. And it was scary, though, because I have COPD from chronic bronchitis, and I have stage 3A kidney failure from taking lithium for so many years, bipolar medication. And then since then, I got better, and then I had the flu, and then I had bronchitis, and then I had a cold. And it just seems like my body is still being attacked by it. I think it's very long lasting. I still need breathing treatments 2 to 3 times a day. I now take a steroid inhaler. I'm on a butyral inhaler, and I take Tessalon pearls for the cough and stuff, because the cough is still here.
Wow. Yeah, a lot of people, and especially the ones, I'm so sorry, April, and I pray you do well. Don't get an STD on top of all this, okay?
Oh, God, that would be horrible.
Anyway, but a lot of people that have been on ventilators, and they've been on them for a while, those people really have very serious effects when they get off. You know, sometimes their thinking is not straight, they're fatigued all the time, they just, we don't know how long it's going to take for them to get back to normal, because we haven't had that much time to know.
Right.
Yeah.
Yeah, it's crazy. So I just went to the store the other day, and I'm thinking, now, what virus did I pick up now? I'm just waiting to get sick again. Like, it's just nonstop.
I'm getting my groceries delivered. Or I was, and then Instacart, the fees were quite high. So now I go into Ralph's, I open up my trunk and they put them in.
Oh,
so
that's nice.
That is a very good way of doing it.
That
because
is nice.
I don't really want to go to the store and have somebody without a mask or someone cough on top of me, you know.
I know my boyfriend was doing security for a large corporation, and they're basically just told if it's a medical exemption, they're allowed in, but if they still argue, just report it to management. So it's like, okay. And then the management just lets them in without the mask. So it's kind of counterproductive.
Yeah, we had an incident in our family. I have a niece called Karen, very unfortunate name. And, you know, there's a lot of memes around, obviously, about Karens. And, you know, Karens, they call them when they go into the store and they won't wear them. Oh, that's a Karen. And my daughter actually reposted something about Karen. And my niece found out, and she thought my daughter was talking about her, which started another shitstorm in the family, because I've already got a sister and her family, this family, that are big Trump supporters, and my relationship with them now is almost zero.
Yeah,
And
my
so
father is a huge Trump supporter, and there's no getting through to him. You know, he even argues with me because I read CNN and he's on Fox News. Like it's ridiculous. So I don't even bother talking to him about it anymore because it would just cause unrest and you know, agitation. So I just don't. But
yeah, I mean, I'm a left-wing Democrat, always have been, always will be, you know, for racial equality, equality for men and women, you know, all the things that I believe in, social justice. And I think that I'll always be that way. But I have never seen a country more divided. I mean, we've had Republican presidents before, but there's never been this much divisiveness and hate as there is in this country right now. And it's pathetic.
it is. It's a horrible time, and it's just, if you think about it, though, like if we had a time machine, like what year would we go back to? Because it really hasn't been too great in this country, and I especially wouldn't want to come to this year. This year is just horrible.
Yeah.
It's crazy.
Yeah.
Yeah. But I want to thank you for joining me today. I had a blast with you. I always love seeing you and talking to you. We'll definitely talk again.
Yes. And thank you for having me. I love you. I think you're a wonderful person. And I hope that this relationship is a dream relationship, because I want only the very best for you. And give a kiss to your son for me, okay?
Thank you. I will. I love you too. Thank you,
Okay.
everybody, for signing in and watching us. Be kind to one another and have a great week. Bye.
Bye-bye, darling. Bye-bye.